I'm Mark Zitter, CEO of the Zitter Group and Chairman of Vital Decisions.
Tell me a little bit about payer management of oncology, your primary business.
Well, the Zitter Group runs the largest and longest running study of payers and oncologists and their practice managers in terms of how payers are managing oncology therapies. There's no question from all of the data we have that management is getting more aggressive. More payers are managing more oncology therapies with more aggressive means. Now, for context, oncology is still less aggressively managed than most disease areas for some obvious reasons. But there's no question payers have been doing more of it. And they're doing more of it primarily through, number one, through prior authorizations, trying to reduce inappropriate care and increase appropriate care. To a lesser degree through clinical guidelines and decision support programs of various types, which are growing fast but still fairly young. Certainly they are managing through site of care restrictions, mandating or encouraging use of specialty pharmacy, for example, for distribution. They have been, for the last number of years, making heavy use of ASP, average sales price reimbursement methodologies that have had a tremendous impact on physician behavior and on practice economics. And certainly cost sharing is an issue as well, although given the crazy patchwork we have of the way patients are covered, with some being covered by one entity or another entity, and even if both the medical and pharmacy benefit products are covered by the same entity, you still very often have strange incentives based on co-insurance versus co-pay, or no co-insurance for expensive infused products, but a co-pay for the orals and so forth. So those are some of the ways payers are managing, and they are being more active on all fronts in oncology.
What is the payer relationship with physicians these days as health reform takes shape and there's more tightening on financial impact and patient care, quality still going up? It seems like that might be a little bit of a tough relationship.
Yeah, payer impact with physicians is difficult. There's never been a lot of love lost there. I will say there certainly it has been, though, for at least many payers and physician groups, a realization that they have to figure out better ways to work together. Mm-hmm. So we are certainly seeing pockets of hopeful working collaborations and experiments that involve some give and take on both parts, where payers are asking more of physicians, and physicians are asking to be rewarded for doing more or getting better results or cheaper results or whatever it might be, the same results at lower costs. So I'm very excited about the potential those have to make a difference, because I think that we're really getting to the point, having complained about how high costs are for decades, and people say, oh, we got to do something about it. I think it seems people are feeling that it's much more serious now, and if they don't do something constructive, things will happen to them. That's both on the payer and the provider side. So we're seeing some better collaborations now.
Great.